Today we're going to be doing a lip enhancement for this patient, and we're going to be using a few different techniques in order to achieve the look that she's going for. So this is actually her second time getting lip filler. We wanted to take it pretty slow. She started with thinner lips, and as you can see, we definitely achieved some good volume already with that first initial appointment, and that was about 4 months ago at this point, and now we're going in with another syringe. There will probably be a before and after at the end of this video to kind of see where she initially started and then where we are now and then where we are after this second appointment. But right now I'm going in with some right angle technique. I have my filler backfilled into some 0.5 ComfortTalk syringes. I like doing this for just more control. I like the 31 gauge 8mm needle, and it also allows me to keep my syringe sterile so I can keep it for an enhancement appointment. So here I am just going along her vermilion border, or just right inside of that vermilion border, to help give a little bit more show. I'm only doing a couple across the top. I'm not keeping them too close together because we already used this technique the first time we treated her. So I just wanted to add a little bit more show in the front. As you can see, where I'm inserting my needle is just right under that vermilion border. We want to make sure that we're still in that lip in order to prevent her from having any migration issues. So here I am in her Cupid's bow. I like to do a pass kind of into the middle of the lip and then one straight down through that Cupid's bow. Typically I like to fan that, but as you can see I came out, but that's okay. The patient is numb. We numbed topically prior to treating, and then there's also some lidocaine in this product as well. So just trying to peek up her Cupid's bow there, and I'm just going to go across this side as well and do a little bit of right angle. We don't have a shot from this patient sitting up, but whenever I'm assessing lips, I like to look at the lip and standing in front of the patient with them sitting up and just see if there is any asymmetry to begin with. And that will kind of help guide me to, how many passes of right angle I might be doing on each side, how many passes of standard volume, things like that. Because our lips are not perfect. No one has perfect symmetry. So that's always something that you want to look at prior to starting your filling treatments, no matter what area you're doing. But I am just continuing along. I'm always tenting up my needle, making sure I like my depth prior to going in and placing product. And we are also always retrograding and aspirating prior to each injection. In the corners, you want to be extra careful to check and make sure that you're not in the wet of that lip. You can get, bumpy areas of product if you are too low. Now we are going in with just a little bit of standard volume, just a few passes to fill in the middle area of this lip. Like I said, this is her second treatment, so we already did these techniques the first time. So now we are just going in and trying to add a little bit more volume. I did give her a little bruise right there. She can take arnica. We will also be providing her with a ComfortTalk lips kit prior to leaving the office, which has arnica in it, as well as hyaluronic acid and a couple other vitamins just to help with that healing process. So nothing to be concerned about there. It's just a bruise. If you're ever concerned, I like to keep a Q-tip on my table. You can use obviously your finger as well, and just check that capillary refill if you're ever concerned. But that there is just a bruise, and then we're going in and doing the same thing on the other side. She is starting to get quite swollen, so I'm trying to hurry up a little bit here. We'll just go ahead and massage and make sure everything is smooth prior to her leaving. But again, just retrograding out and placing some product. Now we're moving on to the bottom lip. Same kind of technique here. You can do right angle on the top and the bottom. She really likes that pouty look, so we wanted to go ahead and enhance that a little bit more for her. So again, aspirating before each injection and then just retrograding out. As I'm tenting up, I'm looking to kind of have that white tone, as you can see right over my needle. I don't want to be able to see the silver of the needle. That means I'm way too superficial. Filler can tindle in the lips, where if it's too superficial, it almost gives like a purple blue tone, which is what Tyndall is. So you definitely want to make sure that you're not placing this product too superficial, but you also don't want to be too deep. Obviously, for vascular reasons, we don't want to risk an occlusion. So always making sure that you're checking your depth prior to placing your product and giving a nice aspiration beforehand as well. Once I'm done with my right angle here, I'm going to go in with a little bit of standard volume. So just focusing on the tubercles of the bottom lip first. So right there in the middle, or the pillows, you can call them as well. Kind of more of a keyhole look we're going for, and just retrograding out product there. When I'm going into the corners of the lip, I definitely keep an eye on how much product I'm pushing. We don't want to have the same volume lip straight across. That gives like kind of a sausage lip, you could say. So you want to make sure that you're watching how much you're pushing and making sure that you're following the curvature of that lip in the direction that it's naturally going. If we're pulling it straight across, again, we can kind of make that lip look too full and just like that rounded look that we're not really going for here. So again, just following the curvature of that lip and filling the pillow on this side. And then going to go ahead and do that very outer corner. Once I am done with the bottom lip, I am going to massage and make sure there is no lumps or bumps. And then I like to set the patient up and just assess again from standing in front of them, have them smile, animate, make sure that they are as symmetrical as possible. Sometimes swelling does go down, bruising goes down, and I always have the patient come back for a 2-week follow-up, just in case any of that initial bruising and swelling does go down and causes an asymmetry and they need a bit more filler. So we will see her back for a 2-week follow-up, but overall I am very happy with the outcome of these. We will put some before and afters just to kind of see where she started, but we are very happy with this plumper, fuller look that she now has. And for now, we are definitely done adding filler for her. She is happy with this size and shape. So we will see her back in probably about 6 months and do an assessment and see where she's at that point. But here's the finished look. I went ahead and applied some Comfort Tox lips to help with the healing process. She'll also go home with that as well for the next 2 weeks.